The next question was on NRP. How much is the adrenaline dosage? It was 0.2 ml. And one idiot statement was there. The answer was you have to secure an airway before putting them on bag and mask. And one question was based on quadruple test. Answer is unconjugated estradiol. We generally use unconjugated. And Venturi mask, one question was there. The answer is FiO2 between 0.25 to 50%. Poisoning question, methylxanthine poisoning is the answer. It had a clinical scenario of hyperglycemia with respiratory alkalosis uncompensated. And one question on Childbirth score was there. Yeah, I went wrong. I'm clueless even now as to what is the answer. And next was kindness Stokes breathing. It usually happens in anything above the level of medulla. So the answer will be mid-brain. And the EDH image question was there. And one question on salmonella sepsis with septic shock. The answer is dexamethasone. And Plasmodium vivax. The answer is IV artesunate. It was because it was a complicated Plasmodium vivax infection. One patient on chemotherapy with galactomannan positive was there. The answer is voriconazole. Azoles take over as the first choice. So voriconazole is our first choice. And fever with rash, one question was there. This I'm not able to recollect properly whether there was one question on meningococcemia. Yeah. And next is acute hemorrhagic uh, rashes of infancy was there. And one case with abdominal mass was there. The answer is Wilms tumor. Not able to frame the exact line of questions. And next, a very severe quantitative defect of von Willebrand's. The answer is type 3. Hypopituitarism clinical scenario was there. And one child, newborn child with pneumonia, and there was eye discharge that when subjected to gram staining, there was no gram staining being positive. The answer is chlamydia, chlamydia tropoma basically. And next is the least gestational age of Ballard's. The answer is 20. Klinefelter's syndrome. The answer is proportionate tall stature, because usually it was an odd one out to be picked up. Because usually Klinefelter's causes unproportionate tall stature. Down's investigations, a clinical scenario, and what do you do next? Kind of was there. And the Piles classification of IVH was there. It was stage 2. Thank you.